to our clinic and they have foot pain, and that foot pain is caused by pain along their arches. Maybe it's the long. Hi everyone, Dr. Cary Yurkiw here. Thanks for joining me today for this webinar called Fix Foot Pain Fast. And we're going to talk about how you can walk better, move better, and live pain-free. A lot of people come into our clinic and they have foot pain, and that foot pain is caused by pain along their arches. Maybe it's the long arch of the foot or the one that goes across, in their heel, or even in their toes. So just raise your hand up in the chat if you have heel pain or foot pain today. Let's talk about what happens inside. The plantar fascia, which is that layering on the bottom of the foot, can get strained, causing a condition called plantar fasciitis. It's the arch that forms the shock absorbing system for your foot. When these tissues are overloaded or irritated, they develop micro tears and inflammation that can cause pain. That's when you feel that sharp stabbing pain with your first few steps in the morning. Understanding the anatomy helps us to treat the root cause, not just the symptoms. Plantar fasciitis is probably the most common condition we see in the clinic. It's the pain at the bottom of the foot that hurts when you take a step. Heel spurs can form when the fascia pulls away on the heel bone, causing a calcification to be deposited, causing a heel spur. Heel spurs can form when that fascia gets pulled away. And other conditions like Achilles tendonitis, flat feet or pronation, or even nerve irritation like Morton's neuroma are conditions that we see in the clinic. Most people try the basics first: rest, ice, maybe a better shoe or orthotic. These can temporarily reduce pain, but they don't fix the underlying tissue injury. The problem is the fascia doesn't heal well on its own once it becomes chronically irritated. Painkillers and anti-inflammatories often mask symptoms, but they don't restore healthy tissue. To truly fix the problem, we need to stimulate proper healing in the tissue, and that's where advanced therapy comes in. Shockwave therapy uses targeted sound waves to activate healing inside the tissue. When we apply shockwave, it breaks down the old scar tissue, increasing circulation and wakes up the cells responsible for repair. Patients often describe it as a deep vibration or a tapping sensation. Studies show significant improvement in the chronic plantar fasciitis within 3 to 6 sessions. In many cases, this is the turning point where pain finally starts to decrease. Laser therapy is the perfect complement to shockwave. Laser uses focused light to reduce inflammation and speed up cellular repair. It boosts blood flow, reduces swelling, and helps the tissue recover faster. This therapy is painless, relaxing, and works especially well when paired with shockwave. Here's why combination of shockwave and laser works so well. Shockwave breaks down damaged tissue and stimulates healing. Laser therapy accelerates that healing. Patients often see quicker improvements in pain, walking, and morning mobility. Most importantly, this approach helps the plantar fascia heal stronger, so the pain is less likely to return. If your pain has lasted more than a few weeks, combining the therapies dramatically improves the results. What you do at home matters just as much as what we do in the clinic. So supportive footwear is essential. Avoid flat shoes, flimsy sandals, or being barefoot on hard floors. Gentle stretching of the calf and foot helps to prevent re-irritation. Rolling the foot on a ball or massage tool relaxes the fascia. These simple habits speed up the recovery and prevent pain from coming back. Here's one of my favorite success stories. This patient had months of stubborn heel pain that interfered with walking, workouts, and sleep. They had already tried orthotics and rest with no relief. After a combination of shockwave and laser therapy, their gait improved, their pain dropped dramatically, and the morning pain disappeared. These are the kinds of results we see consistently when we treat the actual tissue problem. Let's open this up for some questions. Do you have any questions right now about foot pain? You can type them in the chat. I'd be happy to answer those. Or even if you're watching a recording of this, you can type them in the chat and we'll be checking our messages on a regular basis. If you want a strategy session on how we can help you with your foot pain, then scan that middle QR code for a one-on-one strategy session. If you want to come in for a free gait assessment in the Kelowna area, scan that QR code on the right. And if you want to get our book called Fix Foot Pain Fast, then we will drop the link in the chat so you can get our book that's been published on Amazon. I want to thank you for joining me today, and we look forward to talking to you soon.